Welcome to Biotech Talk, your one stop show for all the tidbits from the biomedical and life sciences industry. And today we have a very nervous guest who's making me also nervous. This is like my fourth take. So he's Mr. Russell Mayne. I'm really honored to have you here
Thank you.
after chasing you down a lot. So, Mr. Russell Mayne, just to give you guys a background, he's a digital health leader and has over 2 decades of experience in building healthcare infrastructure that can be digitized. And he is trained as a physiotherapist, right?
Correct.
And also MSc in pain medicine.
Pain science.
Pain science. Yeah. Okay. Do you give pain or take pain?
Try to support people with pain.
Okay. Yeah, that's fun. That's fun. And then you moved into the healthcare records and the digital health landscape of
Correct.
it.
Yeah.
So currently, Mr. Russell is the head of the Dell Technologies Healthcare and Life Sciences Division, right?
Correct. In Middle East and Africa.
In the Middle East and Africa. And he supports the large organizations in digitizing a lot of factors in healthcare systems, private and public, I'm assuming.
Yes.
Yes. It's very cryptic. Okay, so as we discussed, Mr. Russell, we're going to be talking about AI this season because when we had a lot of conversation in season one, we realized that AI was a topic that kept recurring in every aspect of the conversation. So we want to see how AI or digital health is kind of seeping into this industry, especially in this region, in healthcare and GCC, and how is it revolutionizing? It's already revolutionizing many industries around us, the communication, the aviation, every industry. So how is it doing that? And I feel like you are in the perfect position to speak about this, right?
Well, thank you. Yeah.
Yeah.
I think you mentioned the fact that I was originally a physiotherapist, and I wasn't just trained as a physiotherapist. I worked clinically for about, for about 15 years, from when I qualified in South Africa and then working in the National Health Service in the UK at Guy's and St Thomas's. And being on the clinical frontline gives you a different perspective from coming at this from a technologist perspective, right?
Yeah.
And one of the things that I always try to focus on is why we're here, right? And what we're trying to do. We're trying to make the clinician's life better because there's an enormous amount of clinician burnout at the moment. And then, very importantly, we're trying to improve the patient experience and trying to improve the patient outcome. And when I think about deploying AI or deploying just normal technologies into a healthcare setting, I think about it in terms of the Institute for Healthcare Improvement's quadruple aim. Okay. And I've done that for a long time. And that's really around improving the patient outcome, improving the clinician's experience from a workflow perspective, reducing the cost of care, and improving population health. And when you think about any technology that you're looking to institute into a clinical environment, you've got to look at it through those four aims and make sure that you are hitting those aims when you're moving forward with implementation.
Got it. And as he well put, and that's what we're going to kind of deep delve into today's topic, and that is AI ready for healthcare, especially in this region? So we're gonna more deep dive into those conversations. So you've had like over your years of experience, what are the learnings that you would say that is needed for AI in healthcare right now?
Yeah, so I'd say that fundamentally AI is ready for healthcare. But I suppose the question is healthcare ready for AI?
Yes.
Okay, and that's really where we are at the moment. And there are a few things that healthcare technologists have struggled with in the past with implementing normal digital technology. And that's often around the governance that you need around instituting technology in a clinical environment. And, lots of projects fail because we don't have that executive buy-in. And there are a few things that we need to have in place to be able to be successful with any digital transformation. One of them, executive buy-in. We need to make sure that the C-suite is aligned with the project.
And the objectives of
And
it.
the objectives, right?
Yeah.
Looking back to those IHI quadruple aims to make it relevant for the organization. Then we also need to have clinical champions. These are people that are working at the front line that really understand the logic underpinning the transformation that you're looking to put in place. Because we don't just need added complexity. There's so many issues around working clinically on the front line. It's a complex technical environment now, and we need things that are being put in place to simplify, not make things more complicated. And I think that the danger now with AI is that it's another piece of technology to add to already quite a busy technological landscape for clinicians that aren't necessarily technical. And so when we're implementing these systems, we need to make sure that it's completely aligned. There are people that do really strong work in human factors engineering, with user interface engineering, and we need to make sure that those lessons are being ported across into the healthcare environment. We can't institute systems that require clinicians to look at one app and then another screen and then open something else. It's just not fair for those people that are trying to do their brain work to support the patient to now have to try and learn this whole new technical architecture. Everything needs to be simplified.
So it needs to be a very simple plug and play system that they can easily adapt to.
Exactly. Well, in this area, a lot of the environments are already digitized. So we need to be cognizant that we already have that ecosystem in place. And AI, when we look towards bringing in AI technologies, that needs to be incorporated into the current ecosystem. It can't be sitting separately you just have to now go to a different application. And that goes the same for patients, right?
And then that puts a lot of pressure on the clinical and the patient in this thing. So then you're not just making anything easier at that point. So how can an organization take advantage of AI in a healthcare system?
There are a couple of foundational elements that I think need to be in place before we can even start to think about leveraging AI. And often healthcare organizations feel that they have to get into AI immediately because this is like the flavor of the month. And so they start to...
The new fancy toy.
And they start chasing that silver balloon that's disappearing into the distance, right? But what we need to do is we need to put those fundamental infrastructure in place. And when we think about, AI is really an engine that runs on data. Right?
Yes.
So we need to look at data. And there's that maxim of bad data in, bad data out, right? Or a colloquial expression of that term. So what we need to do is we first of all need to collate all the data. It's like 4 C's, right? We need to collate all that data. A lot of healthcare organizations have got data scattered along multiple silos, whether it's in the PACS system, whether it's the electronic health record, in population health databases, in your CRM solutions. We need to pull all that information
all of them
together. It needs to be structured. It needs to be organized. So there's the collation of that data. Then we need to clean the data. We need to make sure that the quality of the data that's going into AI or that's going to be processed later is strong. Because if you've got gaps in that data set, then it's going to be very difficult to get good information out. AI is not something that's going to be able to clean data. That's not the function. The function is to leverage the data that's being pulled in. So we've got to collate it, then we've got to clean it. Then we have to connect it. So we have to take the data that we now have in our organization and we need to connect it to the AI agents. And because we hold all the data, the healthcare provider holds all that data, what's important that we bring the AI to the data. We don't try to get into a situation where we're farming the data out to AI, right? The importance of sovereign data is very important. And that's the connect piece. And then finally, we've got the control. The control of the data is absolutely critical. Cyber security, cyber resilience is a real problem worldwide. We know that there have been issues in the UAE. The BBC is reporting today that that there was a death directly attributed to the ransomware attack that they had in the UK a couple of months ago. So this is real patient care that we need to be careful of, and we have a responsibility to make sure that we control that data and we keep it
Yeah.
safe. So those 4 C's are really important
Very
when we're looking at
important to
developing a foundational platform to then be able to leverage AI.
got it. So, how uniquely poised do you think UAE is currently to receive this, infrastructure, or like this tool, this ever evolving tool that is there? So, how uniquely structured is UAE currently for this?
I think the UAE is in a fantastic position, specifically around a few things. The first is that there is almost a universal acceptance across the country that AI holds promise for us, and it's no more so in healthcare. So we understand what the potential is for AI. There's also a enthusiasm right across the country and deep into the government that we try look at simplifying. You've got the zero bureaucracy ambition of the UAE, and this is what needs to come across into healthcare as well with AI. We've got to look at what is being implemented and how is it simplifying clinical workloads, not adding complexity. We need to make things simpler, and that zero bureaucracy ambition for the whole UAE needs to be translated to healthcare providers as well. In the UAE, we also have a relatively young country, so demographically, we're in a good position. There's less chronicity than what we have in other countries, and also we've got high employment in the country as well. And also to say that we have a completely digitized environment, and many countries don't necessarily have that almost completely digitized environment. And on top of that, we've got the foundations of a health information exchanges and things like that. So everything is set to be able to use
To receive it.
to receive the AI. So the piece that first C, the collate, is those pieces are in place. The clean has to happen. Yeah?
And then you can move into
And
the
then we
step
can look to connect and control, right?
Yeah.
So everything is moving in the right
In the right
direction in the
direction.
country. Yeah.
That's really great, like to know that we are heading the right way. So I think now, like a concluding question for me is like, if you had to, I know you said you're not a futurist, but if you had to be, what would healthcare look like in 10 years?
So I think it was Bill Gates that said that what you can achieve in the short term is always less than what you anticipate, but what gets achieved in the long term is more than you anticipate. And I think the same thing is going to happen in AI. There's going to be a struggle to get things up and running, but the potential is so huge in terms of what can be achieved. If I had to look forward 10 years, I think that the entire landscape of the provision of healthcare is going to be fundamentally changed. Controversially, I feel that we're moving towards fully autonomous primary care physicians. This will support from a workforce perspective. We know there's a massive workforce issue. And I also think that electronic health records will become commoditized and will essentially become free, and they'll be funded through the data that's coming into them. So that data will be monetized, and that will cross-fund the application layer that sits in place. So I think if I look to the future, I think we're going to have autonomous frontline physicians. Okay, we're going to have free electronic health records, and we're going to move to what humans do well, which is socialize their humanness, right? And I think that we're going to see AI start to really focus on engagement. Like, we all know what we should be doing to be healthy, right? Do we do those things?
No, we don't.
No, we don't. So there's the gap.
Yeah.
The gap isn't having the insight, having the information. The gap is the engagement. The gap is being able to work out how we enable this in our own lives. And I think that healthcare is going to mure into that over the next 10 years.
It's gonna like prevent before, like it's gonna be more preventive than cure at the go sort of thing. So when you have so much data that is handled separately, then the healthcare professionals is more of a like they're gonna really engage in the lifestyle of the person, and they're gonna engage in how you can make the good things that you need to do happen, right? Like that's
Yeah.
where it's moving.
Yeah, I think so. And I think that people need to start taking more responsibility for their own
Yes.
their own health, right?
Mm-mm.
We're in a very content consumer environment at the moment where people are just scrolling, they're not engaging, things like that. And I think
Passively just
being very passive.
yeah.
And I think that'll change is that people will realize that nothing changes from being passive. Things only change if you actively change it. It's like the first law of thermodynamics or something, right? You need some action to create a reaction.
Yeah. Newton's first law,
right? And I think we'll start to see that. It's no good just having a wearable device. You need to action the learning that you're getting. And what AI will help with is being able to translate that data into actionable learning in a way that the person will engage with it.
And like, okay, now it's time for me to start. And I think this is where wearables and everything comes into place as well. Like, okay, your watch is telling you, okay, if you don't do this now, you're this thing. Like even my watch, it has a stress level checker, and then for me that is an indication, okay, I need to do some breathing exercise, I need to maintain these levels. So I think that is also another area that every integration of things is coming, and remote access to data is also going to be happening.
Well, we're seeing that with healthcare. If we look at healthcare, it's moved from the hospital setting. There's a big drive to move it towards the outpatient setting. But that'll move on to the home setting, right? So what we're seeing is that it's just moving down, moving further and further away from the tertiary hospital setting. And the wearables will get better at engaging with human beings and being able to affect change in human beings by working out what makes human beings take action.
Yeah.
And that's what will drive a better health outcome.
That's nice. I think that's a good point, as I need to stop. Thank you so much, Russell, for taking out I know it is very difficult to create the time for this. And
well, I have been avoiding you. So
yes, like the plague. But then I found him. He had no choice. So thank you so much for coming. And it was a great conversation, a conversation that was needed to have from the perspective of the technologist itself. So thank you so much. And we hope to have more conversations.
My pleasure.
Again.
Thank you very much for the invite.
Yeah. This is Malavika Kanara signing off. Biotech Talk powered by Leader Life Sciences. Bye.